A 42 years old man from southern India present with chronic swelling of the both lower leg. They are brawny and nutrited with marked skin tropic change. Which is the following organism is most likely origin of this disease? So it is obvious that there is a chronic swelling of the both lower limb. So which organism is responsible? Here the lower Wuchereria bancrofti, Trypanosoma cruzi, Trypanosoma gambians, and none of the above. So here we can see there is the swelling of the both lower limb, and we have to identify the organism. Here there is written that it is a elephantiasis. So this is the Wuchereria bancrofti. In case of the Wuchereria bancrofti, here you can see this is the parasite filarial nematode and accounts for 90% case of the filariasis, and usually diagnosed by the blood smears, and it is transmitted by mosquito. So the vector is the mosquito. And treatment with the diethyl carbamazepine. It is the diethyl carbamazepine, and this is caused by the Wuchereria bancrofti. So the Wuchereria bancrofti, it is a parasite, and the vector is the mosquito, and it accounts for 90% of the filariasis, and it is diagnosed by the blood smears, and treatment is by the diethyl carbamazepine. Wuchereria bancrofti is the commonest cause of the filariasis, leading to lymphatic obstruction, actually the lymphatic vessel obstruction. Normally what happened? Normally here we can see normally the arterial blood, let's see, normally the arterial blood comes to the capillary, and what happened in the capillary, there is exchange of the capillary occurs, and finally the venous blood, it goes to the heart. But what happens in case of the lymphatic obstruction? So we know maximum of the blood, it goes through from the capillary to the venule and after vein, but some of the portion, that such as the 10% or 15%, and they goes back by another pathway, which is the lymphatic pathway. So when there is obstruction of this lymphatic pathway, so what happened? So the blood and the other constituent of the blood, they are deposited in this area, that means the interstitial area, when the lymphatic channel is obstruction. Actually it occurs in case of the Wuchereria bancrofti. That means 100% blood comes, most of them goes through the venule, but very smaller portion, that means the 10, 15 or 20%, it goes through the lymphatic channel. But what happened in case of the Wuchereria bancrofti or filariasis? It causes the lymphatic obstruction. So this small amount of blood component, they cannot goes back, and they typically increase in this area, that means the interstitial area, and finally development of the swelling. Here we can see the finally development of the swelling, which is known as the elephantiasis. An infection with loa is another organism, and when this infection of the loa, it usually affects the eye. And here we can see there is no eye sign. So loa typically occurs in African subcontinent and usually result in generalized subcutaneous infection, including the eye sign, but there is no lymphatic obstruction. So loa cannot obstruct the lymphatic vessel. And trypanosomal infection, Trypanosoma cruzi, it causes this Chagas disease. There this sleepiness develop. So what is the answer? When there is both lower leg the swelling, the organism is the Wuchereria bancrofti. And the loa, it is not true, because loa, it causes cutaneous manifestation, including the eye sign. Trypanosoma cruzi and Trypanosoma gambians, they also not produce this type of symptom. The Trypanosoma cruzi, it causes Chagas disease, in which there is the sleepiness develop. So the answer is the Wuchereria bancrofti.